Welcome to the Cancer Support Community's What's in Your First Aid Kit series. I'm Dr. Alexandra Zaletta, a clinical psychologist and the Senior Director of Research with our Research and Training Institute at the Cancer Support Community. We are a global nonprofit network of 175 locations, including Cancer Support Community and Gilda's Club affiliates, hospitals, and clinical partnerships that deliver more than $50 million in free support and navigation services to patients and families. We administer a toll-free helpline and produce award-winning educational and digital resources that reach more than 1 million people each year. We also conduct cutting-edge research on the emotional, psychological, and financial experiences of cancer patients and advocate at all levels of government for policies to help individuals whose lives have been disrupted by cancer. Our belief that community is stronger than cancer is what led us to create this 7-session program for oncology professionals. We recognize that you, the cancer care community, are on the front lines of care. The care that you provide impacts cancer patients, survivors, and caregivers from the moment of diagnosis through end of life. We thank you for your commitment, your passion, and for your compassionate expertise. It is my true pleasure today to introduce our presenter, Dr. Elizabeth Monks. Dr. Monks is an assistant professor of psychology at the University of Kansas Medical Center, Department of Psychiatry and Behavioral Sciences, and a licensed psychologist in the state of Kansas, whose clinical work is specialized in cancer. In her role, she serves as a faculty member with the oncopsychology program at the NCI-designated University of Kansas Cancer Center. Dr. Monks obtained her undergraduate degree in psychology from the University of Wisconsin-La Crosse, a master's in clinical psychology from Washburn University, and her PhD in clinical psychology at St. Louis University, where she received a graduate diversity fellowship. She attended an APA-accredited internship at the University of Wisconsin-Madison with a focus on integrated primary care and cancer psychology, and then completed a postdoctoral fellowship in psycho-oncology at the Alvin J. Siteman Cancer Center at Barnes-Jewish Hospital and the Washington University in St. Louis School of Medicine. In 2016, Dr. Monks joined the faculty at KU Medical Center. She has research and clinical experience in diversity-related topics, psychology as pertains to underrepresented communities, and multiculturally competent practice. She is also interested in how those areas are considered within psychotherapy and medical center culture and practice. Dr. Monks is passionate about the development of diversity training for students, faculty, and staff alike. She is enthusiastically involved in the teaching and supervision of clinical psychology interns, practicum students, and postdoctoral residents. Currently, Dr. Monks provides clinical services to cancer patients and their caregivers, with expertise in the presenting concern and challenges of patients seen in the KU Cancer Center blood and marrow transplant program. She implements brief cognitive assessments, inpatient consultation, and psychotherapy informed by empirically supported treatments for mental health issues. Her interest in existential concerns, quality of life, cancer survivorship, sleep disturbance, and the connection between physical and psychological health are important aspects of her clinical work. She has also collaborated with community-based organizations such as Cancer Support Community, who are working to meet the needs of underserved populations. And on a personal note, she's one of the finest clinicians and colleagues that I've ever had the privilege to work with. And so with that today, please welcome Dr. Monks.
Thank you so much, Alexandra, for that wonderful introduction. It almost made me tear up a little bit. I miss you. And it's a testament to working as a team and how important it is to have great colleagues and team members around you. So it's very, very pertinent to what I'm going to be talking about today, which is equipping your first aid toolkit with things that just go beyond BandAids and how to grow your team to be as mighty as it can be. So the first thing that I don't have any disclosures, no financial relationships or affiliations to disclose. I want to just kind of quickly go through what I hope to accomplish and cover today. That being a little bit of a recap about burnout and compassion fatigue. These are things that I'm sure you're all familiar with and have heard of burnout, have heard of compassion fatigue. But I want to just go through and clarify some definitions so we're all kind of speaking the same language. I want to talk a little bit about the impact of COVID-19 on us as, cancer carers, caregivers, practitioners, clinicians. Obviously, the impact of COVID-19 has been huge, and I think had a huge impact on how we have all been operating in our own teams. And then, of course, talk a little bit about some team-based approaches to addressing whatever concerns may be present in your institutions or on your teams, some ways to intervene and some different ideas to kind of get things going in that direction. So the official definition of burnout is the chronic and physiological syndrome of perceived demands from work outweighing the resources that you have in your work environment. So I think when I think of burnout, I think of a scale where you have your demands of work and then everything that you need to be able to do that job, and the scale is totally tipped. So you have all of these demands with no resources to do it, or limited resources, whether those be practical resources, systemic resources, institutional resources, personal resources. And some of the things that we see in burnout is depersonalization, emotional exhaustion, and a reduced personal accomplishment feeling like you're accomplishing anything is just sort of gone when you're burned out. And that depersonalization, I think, is kind of the cynical attitude you may observe in other people, or maybe you've observed it in yourself. When you're just kind of callous and your attitude is really kind of just funked out, you're kind of detached or negative and feeling like those attitudes are inappropriately impacting either your work as a team member, colleague, and especially when people are really burnt out, that negative attitude really starts to impact patient care and how we take care of our patients. When the emotional exhaustion is high, and workload is ever increasing compared with institutional stress that inevitably plays a role, that's when we get burnout. So oncology providers, specifically those who work in oncology, already have a heightened risk of burnout. It's probably no big surprise there. High demands of acutely ill patients and their families, excessive bureaucracy. I loved seeing that in writing, because excessive bureaucracy is something that I think is hugely problematic, at least in my neck of the woods. It just makes things harder. The emotional toll of the work, discussion of life-changing treatment decisions, delivery of bad news, adverse effects that you see or have to manage or help patients navigate or deal with, and then, of course, sometimes constrained resources. There's some decent research. It's kind of good and bad, right? So the American Society of Clinical Oncology found that between 2015 and 2019, rates of burnout were increasing. I would imagine, and I think we have seen in some of the emerging research that has come from looking at provider burnout since COVID started, that the burnout rates have only continued to increase. So I think that trend from 2015 to 2019 has only continued. With about 45% of clinicians and providers having at least one symptom of burnout from 2015 to 2019. And the other side of that coin is that 80% of clinicians were satisfied with their career and specialty. So oncology is interesting. I think working in cancer definitely heightens the risk of burnout, but we have a bit of protection in that I think many of us that are working in cancer find it incredibly meaningful and incredibly purposeful. And there's a lot of satisfaction, which is why I think we keep going and doing what we're doing, even though the work is really hard. It's also really rewarding. So there's a bit of a protective factor there. Some of the effects of burnout include anxiety, irritability, mood swings, feeling like your quality of life is decreased. Sleep disturbance is a big one. Feeling like a failure, or having a negative self-concept, depression, or low mood changes, substance abuse, health issues, and decreased job performance and satisfaction. So those are some of the effects. I think those are probably no-brainers. Most people probably are familiar with the effects, but just wanted to review them. And part of the reason that I think it's important to talk about what burnout is, talk about the effects of burnout, and of course here talk a little bit about compassion fatigue, is because I think it's important as a team to be mindful of what these things are and what they look like, because I think we're more likely to recognize it in a colleague or a teammate than in ourselves, or we may start to recognize it in ourselves, but sometimes it really does take someone else saying, hey, I'm noticing that you are struggling. What can I do to help? So I think it is important to be mindful of these things as a team member and as a colleague. So compassion fatigue is thought to be a combination of secondary traumatization that's precipitated by the care delivery that brings healthcare professionals into contact with suffering. So compassion fatigue is just being worn out from caring so much, that deep empathy that comes when you're witnessing or experiencing patients that are going through really life-threatening, life-altering, traumatic circumstances. That exhaustion is deep, it's physical, it's emotional, and can sometimes resemble what we might think of as a depressive state or depressive episode or PTSD. And the helper sense of hope and optimism about the future really shifts in their value of the work that they do. So a lot of that starts to kind of, when you're so fatigued from offering the compassion that is pulled for in the work that we do, there really is a true shift in kind of our values, how we see the world, similar to what happens when you experience your own trauma. That there really is a shift in perspective and how you're interacting and seeing the world. And being a compassionate carer, clinician, provider, can be fatiguing, and it can have a huge impact in how we're operating. So healthcare stress, I feel like we're kind of set up. Some days it feels like we just work in a breeding ground, working with cancer survivors, cancer caregivers, family members. This work that we do is perfect grounds for breeding burnout and compassion fatigue, which means we just have to work extra hard to make sure that we're protecting ourselves and protecting our team. But in healthcare, and especially in oncology, there are traumatic injuries and stories. You are in a position where you may be observing patients with extreme physical and emotional pain, interacting with and observing distressed and grieving families, experiencing your own personal grief. I know that is not something in my training as a psychologist that I was ever prepped for. We talked a little bit about like what it might look like to lose a patient to suicide, but there was not a lot of training in how you care for yourself when you lose a patient to something like cancer and you have your own grief, and what do you do with that? We, I think, are in a position to bear witness to emotional states that are tough, like anger and depression and anxiety. and experience emotional and physical exhaustion, both in ourselves, but also in the people that we are taking care of. And then, of course, the stress of dealing with death and dying in that process that we are inevitably going to come in contact with in the oncology world. So what we have all chosen to do is very meaningful work, but it's tough. Some of the characteristics of fatigued clinicians, I think it's important to be aware of some of these things so that we can point it out in some way if we observe it in a team member. And I think there are gentle ways to do that, you know, not just, wow, you're really burnt out and fatigued, you better take care of that. But, you know, being able to say, hey, I've noticed that you are saying that you're exhausted or really worn out, or you're having trouble sleeping, or you notice headaches, stomach aches, someone has a change in appetite, you know, frequent bouts of sickness, I think are something that you might notice somebody else struggling with. Some of the other characteristics of fatigued clinicians, and this doesn't have to just be clinicians, like this could be, you know, somebody that might be more in a research role, or you know, different types of carers in the oncology world can experience this type of fatigue. So often feeling irritable, feeling overwhelmed by the volume and the content of work. In relationships with patients, if you are in a setting where you're working kind of one-on-one or with patients day in and day out, some of the characteristics of fatigue clinicians are a sense of reduction in your baseline empathy. So like, you know, usually I am very empathic and understanding and caring, but right now I just do not feel that way. I feel even more numb maybe to patients or families and their pain that they're going through. Again, that cynicism regarding change, or like starting to perceive patients as responsible for a lot of their problems. From an organizational standpoint, some of the characteristics of fatigued folks is reporting a sense of feeling scattered or just not able to meet their obligations professionally or even personally. So those are some of the things I think we can sort of be on the lookout for when we are thinking about, like, okay, when you're kind of taking the pulse maybe of your own team, like, are we fatigued, are we burnt out, are the people around me experiencing these things? So compassion fatigue and burnout have a lot of overlap, and I'm sure just as I've been talking, you can tell that there are some areas where these things look alike. But I also like to point out that there are some ways in which burnout and compassion fatigue are slightly different. And this little chart, I think, does a nice job of pointing out the basic sort of differences. Burnout can happen with any job, any career, whereas compassion fatigue is very much related to those who are in a helping profession. Burnout tends to be more connected to the environment, I think, because of that resource piece, like high demands from my environment and not a lot of resources in my environment, versus the compassion fatigue is much more relational in nature. Burnout tends to be cumulative, like it gets worse and worse and worse and worse over time, whereas compassion fatigue can kind of happen a little bit more quickly. Burnout is connected to the demands of daily life and daily work life, and compassion fatigue is more of a connection to the empathy that you put in to your role as a helper. And burnout is categorized or characterized by a negative attitude toward work, whereas compassion fatigue is more about the exhaustion from solely just from witnessing suffering. So those are some of the ways that I kind of try to differentiate what's burnout versus what's compassion fatigue. So why is all of this important? Well, obviously, fatigued clinicians, burnt out clinicians, people that work in oncology, whatever way that looks like, if you're a researcher, a nurse, a doctor, a social worker, a geneticist, somebody in administration or scheduler, whatever the case may be. If you're burnt out or you're fatigued, you can't do your job very well. And that is going to impact patient satisfaction. It can delay or make patient recovery longer. Retention and turnover can be problems. Patient safety can take a toll when you have people that are taking care of others that are burnt out or fatigued. Mistakes can happen, and obviously that can have an impact on patient safety. It's really, really important that steps are taken to ensure everybody is functioning to the best of their ability in whatever ways that they are helping. And facilitating your own personal well-being and avoiding burnout and compassion fatigue is clearly one way that this can be achieved. But when I read that bullet point out loud, I think, yeah, right, easier said than done. And that's why this talk is a little bit more team focused, because I think it's hard to do it for yourself, and we might be more likely to take heed in somebody else's observations or a close colleague or team member saying hey, what can we do together to work through this? Or obviously working from a personal self-care standpoint is important, but I also think that the team approaches are critical, and for things to be built in, knowing that we all do work in areas where burnout and fatigue can be high. Um, for some clinicians, the experience of compassion fatigue can become so severe as to interfere with their ability to clinically be effective, which is tough. If you think about when you go see a provider for something important, you don't want to see the person that's burnt out. That they're probably, the interactions are going to be impacted, and you're going to probably worry about what kind of care that you're getting. So these things are important. We can't talk about team approaches without talking about the impact of the pandemic. We've taken already at-risk healthcare professionals, people that are in helping professions that already put them at risk for things like burnout and compassion fatigue, and then we throw everybody in a pandemic. Not only us as helpers, but all of us as all of our patients also thrown in with it. So everyone's stress just went through the roof all at once. If you didn't have to adjust to working from home, job changes, changes with your kids and parenting roles, and all the things that all the ways that the pandemic impacted all of us on very personal levels, we also possibly had the adjustment to all of a sudden having to work from home, or if you didn't work from home, if you kept on doing your job in person, seeing patients, thinking about your own safety and potential direct exposures. I remember in the very beginning continuing to do inpatient consultation work and getting consults for cancer patients with COVID and thinking, am I absolutely insane that I am going to see this patient, and managing my own anxiety and that of the patient and everything else, that COVID had an impact on: longer hours, increased intensity of our work, general increase in the stress in their work environment, in some cases, even more sparse resources. And then in some cases, I think isolation, a lot of the ways that our work changed, I think our teams were really became disjointed. I don't know if other people feel that way, or if there are other things that you can think of. Feel free to throw it in the chat, how you think the pandemic specifically had an impact on teamwork, because I think there's probably a million ways and probably unique ways to everyone here in which the pandemic impacted your teams. For me, it felt like our teams got really disjointed really quickly, and we had to work really hard to kind of come together. It took very conscientious efforts to do that. So what are some of the things that you can do or you can implement to help sort of beat burnout and also build some resiliency and do that as a team. When folks are focused on establishing and maintaining boundaries, self-care, good training for whatever your role is, and good supervision and professional support, you have folks that thrive as compassionate professionals. And I don't know, I believe that those four things um, are enhanced if you have leadership involved in ensuring those things and some team accountability. Those are all boundary maintenance, self-care, training, supervision, professional support. Yes, we can be responsible for some of those things as individuals, but I also think that team approaches, whether that's a discussion as a team, like where are we all struggling with maintaining some of our boundaries. I know our psychology group here talks a lot about, okay, what are we doing to protect ourselves because nobody else is going to protect us for us. I know our nurses have a huddle every single day, and I've heard them talking a little bit about boundary maintenance and self-care, and just trying to find ways for your individual teams to talk about these things, talk about good boundaries, talk about what people are doing for self-care, talk about training opportunities like this is a great a great idea. Like, let's do this first aid toolkit together as a team, everyone, let's log on together, and then let's make some time afterwards to discuss it and talk about it. There are, clinicians, when you ask people what do they need, what helps with beating burnout and what helps with building resiliency, actually a lot of clinicians say that counseling and psychological support is really important. So reminding your team if they have access to EAP or different, resources that might be out there, for like online therapy, or reminding people there are resources out there if they need them. Workshops and courses, again, like the one that you're all attending right now. If you're in a leadership position or you have the ability to talk to somebody who is in leadership, suggesting like, hey, it would be really helpful if we could all take a course or attend a training, or I think some are lucky enough to be able to afford to have like consultants come in, or maybe there's somebody in your institution already that can help out. Flexible work hours is also something that I think most people would say, like, yeah, a great way for me not to burn out and a great way for me to continue to be really resilient is for me to have flexible work hours. And I know that is like a dream that not everybody has the ability to achieve, but I do think that it is really important for those in leadership to hear that flexible working hours is key to beating burnout. Like, clinicians say that time in and time again, if I could have some flexibility, and I'm not talking about working less, I'm just saying, like, if I can have some degree of autonomy or control over what my hours look like and flexing to do that, not do less, but do more, or do what I do with some flexibility. I think having that control and that ability to do that is one of the most important things that helps helpers feel less burnt out. So some other kind of team approaches, preventing burnout, there are like the usual things like exercise and eat a balanced diet and sleep well and ask for help, like all these things that you're like, okay, sure. But when you're stressed and you're burning out and you're fatigued, these are probably the things that honestly will quite easily fall to the wayside. And so this is where I really do believe that teams can be effective. Now, if I told our team of physicians, like, everybody go out and walk over the noon hour, they would probably laugh in my face, and say there's no way we're doing that. So some of these suggestions may or may not work for whatever you do. So I just encourage you to think about how you might adjust it for your team or your group. So we have here a big meeting for like 3 hours every Tuesday. Something that I'm, you know, not always looking forward to, where every member of the team gets together, all of our physicians, our NPs, our researchers, our psychologists, our social workers, everybody's there, and we discuss patients that are preparing for a stem cell transplant. Now, what we have implemented is doing some kind of like yoga or breathing or something midway through the meeting, just to kind of get everybody to stop, regroup, take a mindful minute. And we do that as a team. So if you can't get people out to like take a walk over their lunch, because let's be honest, some of us don't really like get a lunch, or you're taking your lunch at 4 p.m. or whatever the case may be, some of these team approaches, like, think about how you can adapt it to meet your team needs. Planning a team lunch and ordering lunch for everyone, and offering healthy options, finding ways to disperse resources, like even if that is done by email, letting people know, like, hey, there's this cool, cognitive behavioral therapy for insomnia app, or like something that you can check out, that might help with, your sleep, or whatever the case may be, finding ways to disperse resources to your team, and then having team check-ins in whatever way that looks like. And if there already are opportunities for check-ins with your team, thinking about how you might like revamp those check-ins so that there is a little bit more of a focus on addressing burnout or addressing fatigue, and building your team back up after we've had something that I think has kind of, maybe had us all kind of fizzle in our teams. Some of the things that we have implemented at the Cancer Center here, and finding a person to sort of take the lead is tough. I think as a psychologist in a cancer center and on a team, it's natural for people to be like, ask Dr. Monks, she's a psychologist, she knows how to like save everybody, right? Which I don't. And we have to manage our own, burnout and fatigue. But it has been interesting to be, I don't know if utilized is kind of the right word, but like asked to step into some interesting positions in supporting our team and our staff when stress was really high during COVID, and being sort of seen as an expert in a way that I never really thought about before. Like, I'm very focused on supporting our team in patient care and supporting our patients through their cancer treatments. But it's been a unique opportunity, I guess, to also put to use some of my ideas and expertise in helping us kind of as a team, and helping, nurses or whoever the case, whoever is involved in the team, get through. So some of the attempts that we have made, and let me tell you, our institution, just like anyone else, has its issues, has its concerns. We all have our struggles. So one of the things that we implemented was this thing called the COVID Coping Corner, which is something that I update. It started just being me. I have elicited the help of other staff to update the COVID Coping Corner, which is located in our break room. So when people actually have a second to run in there, run out, grab a lunch, sit down for a second, there we use this big whiteboard to put up either just different resources, or a little distraction technique, or a coping exercise, or a mindfulness exercise. We've done app of the week, some literature, especially in the beginning, about like things you can do with your kids, like just focus on like eating dinner with your kids because that's the best thing you can do. We know you can't be their teacher, when people were really adjusting to having kids at home and doing online schooling and sort of navigating that. So this COVID coping corner turned into a monthly thing where we just kind of dispersed resources so people had access to things that might help them cope. And then we turned it into kind of an email blast every month also to try to hit the people that were working from home. We've established a culture committee just because our culture, workplace culture in the Cancer Center, sometimes I think was contributing to burnout and fatigue. And so we've been working to assess teams' needs across the board and implement some strategies kind of from a higher level up, down, which has been helpful. We've had some mandatory cameras on team meetings, which I know some did not always love, but being able to see each other's faces when we were doing a lot more Zoom meetings really seemed to help with engagement and being able to like see and check in on each other. So that's something that we have tried to make kind of a mandatory thing for our team, different variety of team meetings. And then the Cancer Center does these things called Cancer Center high fives, which are incredibly corny, but also so uplifting and gives a chance for us to nominate our other team members. Like, hey, I saw you doing this awesome thing, or hey, this person is really going above and beyond. Like they deserve a high five. And so we've had some folks in our leadership put together an email blast that goes out, I think also monthly, just recognizing folks on our team that are going above and beyond or doing great things. So those are just some things that we have attempted and tried. I'd be curious to hear what other people have tried on their teams for trying to prevent burnout, beat burnout, support each other, and do that growing mighty as a team. I often challenge everyone to think about one place that they can make a difference in their team, one thing that you can take on, one thing that you can do. I had a team member the other day invite me to a book club. And that's her thing. She's like, I'm starting a book club. We're gonna read something light and funny and get together and discuss it over like virtual happy hour. Find a way that you can make a difference and a way that you can get your team engaged, I think is important, because even if it's small, if we're all doing that, then hopefully we get a cumulative effect, right? That's the hope, at least. So the definition or the title of this talk is beyond Band-Aids, right? And so I think this picture sometimes highlights like what our team dynamics look like a million problems, a million holes in the dam, and we're all just like trying to like put these band-aids on all these issues and concerns to keep us from being drowned out. But sometimes those band-aids or quick fixes are not things that sustain our teams for the long haul. And I think because there have been so many changes and adjustments, now is kind of a good time to be thinking about what kind of changes can we make in our team environments that are going to last, that aren't just a band-aid, that are actually things that are meaningful, that we can keep for the long haul. And if you don't have a team, I think it's important to develop a team and find your team, find your chosen family, so that it doesn't feel like you're operating on an island, because that is a terrible, awful feeling when you feel like you're just all by yourself. And I know that in some cases people do really feel like they are siloed off and working alone, and it's a tall task, but finding finding a team, even if it's a online team, or, I think about the different collegial relationships I have and how important it is to still have a team that's like outside of my team here at the KU Cancer Center, but being able to connect with people like Dr. Zaletta, even though, we aren't in the same place anymore and we both work in very different teams, I still try to think about what my team outside of my team looks like, if that makes any sense. Because those chosen teams do tend to last because of the relationships that are there, because sometimes the teams that we're handed are tough because we didn't pick them. We're just kind of thrown together and have to work together. So I do think it is important to be thinking about the teams that you choose for yourself and what control or power you have on what those supportive relationships look like. Supervision and mentorship, kind of talking in the same breath, are also really important. And even if that is just means my mentor, I have many mentors, is not necessarily a team, but I do think of us. We're a team of two in some cases, and sometimes that is all that you need, is that one person who's got some wisdom, got some experience, that can sort of be there for the long haul. So not somebody that's just a band-aid, somebody that's just going to be there for you temporarily, but professionally, what does your supervision or mentorship look like? Because those are those lasting relationships that you'll want to keep for the long haul, that can make a huge difference. I think some of the starting points of getting beyond the band-aids comes to assessing exactly what your team needs are. And sometimes the feedback that can come from that, and I can say from personal experience in working on our cancer center's culture committee and doing a survey on, hey, what do people think about the workplace culture around here? We got some feedback that was hard to hear, but I do think that eliciting honest and anonymous feedback from your team helps us get beyond band-aids, because we really get down to the nitty-gritty of what people's experiences are and where change needs to happen. So although assessment of needs doesn't always feel like you're doing a whole lot, it's kind of a first step to figuring out how you do get beyond those temporary fixes. The ProQual, or the Professional Quality of Life measure, is accessible online. You can Google it. It's something that our team here takes yearly, just to have kind of a pulse on our compassion fatigue and our burnout, and also our satisfaction with our work. So we've just implemented that as something that we do on an annual basis. There's a great single item Maslow burnout question. There's a whole Maslow burnout questionnaire inventory with a lot of questions, but I love this single item because it's just one question that asks the person to think of their own definition of burnout, and then decide for themselves kind of on what level they feel that they are with burnout. And it's a validated single item measure, which is great, and it's quick and it's to the point, and it captures a lot of information if you want to try to look at where your team is on the burnout scale. And then, when you get that assessment done, identifying themes and making an action plan, and trying to get as many invested stakeholders as you can, having buy-in from leadership in whatever way that looks like is I think important. Or if you're the leader on your team, it's something that I think it's important to prioritize, taking a pause, taking the pulse of your team, and then creating an action plan to address what the concerns are, and also giving feedback back to your team, I think is important also. Celebrating wins is important. I think there are a lot of wins that happen a lot, but they just get overrun with the next crisis or the next fire to put out. And so taking time to recognize what your team is doing well is important. and identifying the band-aids, like where has our team put a band-aid that we need to change or alter or fix or turn into more of a lasting change, and what needs to go into that to make that lasting change. So those are just some ideas about how to get beyond the band-aids. Team diversity considerations is like something that I could talk about probably for hours. It could be its own discussion. And I know there are other parts of this first aid toolkit series that do have a little bit more of a focus on diversity. But diversity, equity, and inclusion is a huge passion of mine, both in teamwork, in how we supervise and how we mentor, how we interact with patients, and how we interact with each other. So, is there any kind of diversity, equity, and inclusion committee or group at your institution or place of work? And if there are, they might be a great resource for how you can be attentive to these things in your team. If there's not one, maybe it's your task. Maybe this is the thing that you do or you start for your team. And it doesn't have to be this big grand, our small team of 5 is creating a whole diversity committee, but maybe you make sure that in every meeting that you have, there's a diversity minute, or there is some sharing of a resource or discussion of a patient concern or a personal concern, or a space that you provide your team to process. I mean, the last year has been stressful for a lot of minorities and people of color, for the Jewish community. I mean, you name it. If you belong to a minority group, it's been a tough year. And so on your teams, I know I really appreciate when my teams are like, hey, can we take a minute and just talk about what's going on in the world, or leave a little bit of safe space for people to process or talk or think or just be kind of authentically themselves. We know that women report higher burnout, and non-white clinicians and people who work in the cancer world report less compassion satisfaction. And sometimes I wonder if that's because we're burnt out from all the other things that we have to navigate day in and day out, that we're burning the flame from both ends, so to speak. If there are ways that your team can work on allyship in whatever way that looks, I think that is an important piece also. Advocating for trainings, resources, continuing education that is focused on diversity considerations or trainings, so that your team is building cultural competency to the best of their ability, not only for working with each other, but also working with the people that we serve in the oncology world. If you have trainees, making sure that you're leaving space for them to process what's going on if they happen to be a member of a minority group, and considering your own group or team dynamics and power differentials and how that may be impacting how your team is working or operating. The multicultural orientation philosophy is something that I think is designed to help focus on clinical work, but I think the model is helpful when we're thinking about interacting with each other and doing that from a place of being culturally humble, taking advantage of opportunities to learn and grow, and increasing our own comfort with the discomfort that sometimes comes up when we have to talk about tough diversity related topics, or sit and hear how we maybe had a misstep, or get feedback that's tough to hear. Thinking about diversity, equity, and inclusion and justice from a team standpoint, I think is a critical piece of how we continue to grow mighty in our teams. And again, I I often just challenge people, even if you're just one person, like what small change, what small thing can you do or implement on your team that'll make a difference, because all of those even small changes that feel like they're maybe not making a difference, I truly believe that they can accumulate to make an impact. So with that, I will wrap us up and see if there are any comments that you want to put in the chat, questions that you want to throw in the chat, anything that we want to discuss in the last few minutes. I'd be happy to. Thank you all for being here.
Thank you, Liz. Actually, I am going to challenge the group today to chat at us. You asked a really important question, which is, where is one place I can make a difference for my team? And I would love for you all to make a commitment to yourself. And if you'd like to chat it my way, then we can honor it and give a little space for it. I think that one of the question that came in while folks are considering their commitment to themselves is, there was a question about mentorship and the importance of mentorship and understanding that. And the question was, I've always hesitated to volunteer or mentor because it seems like one more thing to add to the plate. Any tips on how mentorship can be kept light and not feel like a heavy responsibility?
That's a great question. And if it is too much, and it's kind of that same idea, right? Like if it's one more thing that you have to take on and it's going to impede your ability to be a good mentor, then maybe it's something that it's not never, but maybe just not right now. The boundary maintenance stuff is also really good. And I think who you choose to mentor and assessing what their needs are is important. If you're like, this is what I have to offer, I can do, monthly, 30-minute check-ins around your professional development, or, really being careful and considerate about who you take on as a mentor, I think could help create and give the opportunity to have some relationship and mentoring that isn't so heavy, or kind of refraining from taking on mentees that have a lot of high needs that would require more than you're able or willing to give.
Great. You also had asked a question about where can BandAids or temporary fixes be improved. How would our participants today even go about understanding if some of the quick fixes or BandAids are simply that and aren't going to get to the depth of really growing mighty as a team? Can you give us some tips on what to look for?
Yeah, look for the cracks. That's how I try to, when I think to myself, man, I'm kind of getting by doing my job, but this isn't sustainable. Or what does this look like 6 months from now? Or what does this look like in a year is a great question, I think, to identify those places where you're like, yeah, if we keep going at the pace we're going, or if we keep doing things like we're doing them now, they aren't going to be sustainable for the future. I think that's a good way to pick out those places where BandAids have maybe been implemented. Trying to think if that's a great question. It's like, how do I even know it's a Band-Aid if nobody's telling me? But eventually they start to wear off. So I'm guessing maybe if you're looking or thinking about it, you might start to see that Band-Aid slowly peeling off.
We did have some folks write in about how they can make a difference, and a lot of it was related to checking in, regularly. We have folks that are sending emails with resources on a consistent basis. I think it also, the challenge before us, Liz, and it's a question that's come in, which is, all right, let's say I make a commitment today to make a difference on my team. How do I make that sustainable, right? So you talked about your COVID corner, and then you started it, and then you needed to kind of elicit and solicit for some support, right? How do you create that from the beginning so that you don't feel resentful about being the champion for a resilient team in the midst of everything else?
Accountability is really key. I think if I was like, oh, COVID coping corner, that's great. And honestly, if it weren't for other people being like, hey, Dr. Monks, it's time for a new coping corner, I probably would have let it go to the wayside just because I got busy. And it sounds like a great idea. And I think we all probably overcommit ourselves. So if you are going to make a commitment, identifying somebody that can help hold you accountable is important. And then also asking for help. Like, you don't have to do everything by yourself. And here's your team approach again. Like, if you can get other people on your team involved and share the load and share the responsibility, I think it's more likely to be sustainable across time versus if you're just the sole person doing it.
Great. Well, before we move to the next slide where I talk about what's happening next, let me just let the group know that the ideas that have come forward, besides the email, the checking in, it's using humor and whimsy and everyday approaches, being honest with our own selves, right? That idea of emotional intelligence and self-awareness, so that we can continue to give both to patients, to caregivers, and to our colleagues. So if you'd like to go to the next slide, then I could tell them what's up. So this is your stay tuned for more sessions advertisement. In a couple of weeks, we have a treat for you. We're going to go behind the mask. Today, we were ripping off BandAids so that we could have a real meaningful conversation about growing mighty together. And in a couple of weeks, we're going to take off the literal and figurative masks that we hold to cope. And what are those areas of moral distress or injury that can lead to burnout, so that we can continue to demonstrate compassionate care. And Dr. Traeger from Harvard will join us and lead us through that. And then our final session is about systemic racism and sexism and homophobia. Sometimes we can be in a yoga pose all day long and we still feel wore out because it's a system issue. And so how do we begin to identify maybe we're in the wrong place, and we need to get a different level of support? In our very own cancer support community, Eukarya Borden, who leads our health equity teams, will join us and lead us through how do we know there's nothing wrong with our kit, we've got the best resources, but there's something wrong with the system. I want to thank Dr. Moons today and for being so generous with your time. I want to thank everyone who came today and gave up about 59 minutes of your day. I want to wish you well, but I also want to just applaud you and thank you for the impeccable and amazing care you give every day, whether it's through a Zoom group or whether it's at chairside or bedside, depending on your setting. Take good care, everyone, and we'll see you in a couple weeks.